Rotavirus. Rotavirus is the most common cause of diarrhea in infants and children. Until they reach the age of 3, most children will experience at least one episode of this virus. The rotavirus infection is unpleasant, but it is easy to treat. Drink plenty of water to avoid dehydration, and in severe cases, intravenous fluids may be required. Rotavirus symptoms. The virus can be found in human feces for several days before rotavirus symptoms appear and for up to 10 days after the disease has passed. Rotavirus has a wide range of symptoms. 1. Rotavirus symptoms in general. The symptoms of rotavirus infection are as follows. Extremely hot weather. Watery stools. Throwing up. Abdominal discomfort. It lasts 3 to 8 days, and adults experience symptoms more frequently than children. In adults, the rotavirus may cause only minor symptoms or none at all. 2. Symptoms that necessitate a doctor's visit. It is recommended that children see a doctor if they develop any of the following symptoms. Severe diarrhea with blood. 3 hours of continuous vomiting. A rise in body temperature to 39.5 degrees or higher. The child is in excruciating pain. The presence of dehydration symptoms such as a dry mouth, no tears, small amounts of urination, or drowsiness. Rotavirus causes and risk factors. During the course of the infection, the virus is easily transmitted from the hands to the mouth, and if the infected person does not wash his hands after touching the virus-carrying secretions, he transmits the virus to everyone who comes into contact with it, and from there, the infection may spread to anyone who comes into contact with the surfaces he touched. Because there are so many different strains of rotavirus, you can get it more than once in your life, but the second infection is usually milder. Hazard factors. Infection with the rotavirus is more common in the following situations. Children between the ages of 4 months and 2 years, particularly those in nurseries. The winter and spring seasons. Complications of rotavirus. Acute rotavirus infection can cause dehydration, especially in children, and failure to treat dehydration properly can result in death. Diagnosis of rotavirus. A stool sample from the patient is taken and analyzed to diagnose the disease. Treatment for rotavirus. There is no specific treatment for rotavirus, and because we are not dealing with bacteria, antibiotics are not effective. The disease usually goes away on its own in 3 to 8 days, and the main concern is to avoid dehydration. Only the following symptoms are treated. To avoid dehydration during an illness, it is important to drink plenty of water. It is preferable to give children who have had diarrhea for several days fluids that contain salts, such as mineral salts, because these drinks may help them avoid dehydration. To replace lost fluids, intravenous fluids must be administered. While it is preferable for infants to increase their feeding meals, milk substitutes must be continued to be given without diluting their concentration less than usual. Juices, milk products, and sugary foods should be avoided because they can aggravate diarrhea. Preventing rotavirus. Hand washing with soap is important to prevent rotavirus infection, especially after using the toilet, changing diapers, or helping a child after using the toilet. To prevent infection, there are 2 types of vaccines available today. 1. Rhodarix. At the ages of 2, 4, and 6 months, this vaccination is given orally in 3 doses. Rhodarix should not be used to vaccinate adults or older children. 2. Rhodarix. It is a liquid vaccine that is given in 2 doses at the ages of 2 and 4 months. If a child has abdominal pain, vomiting, diarrhea, stool bleeding, or any other change in bowel function after receiving the vaccine, seek medical help right away.